talked about that is a passive range of motion. It's considered passive that the patient can do, are called Codmans, or they're sometimes known as pendulums, or they're known as Codmans pendulums exercise. And basically what they do is you lean over, okay, and you let that arm just hang down. The idea with the pendulum is supposed to be that you want to use hip motion enough to cause the arm to swing, okay? So the arm's not swinging this way. I tell my patients, I say, if nobody's whistling at you when you're doing these, you're not doing them right, okay? Because when you do them like this, if you're doing this, it's active, okay? And if I'm supposed to be on my passive phase of doing it, you don't want to cause any damage or increase soreness. So when they do it, sometimes I'll have them do it in a pure plane. So I might have them, I call this the bowling move, okay? And all they do is let that hand get heavy and they pretend like they're bowling. This here, when they go side to side, it's like the swinging elephant trunk, okay? And it's the weight shift here that actually gets that arm to swing. If you get really good, you can do a little bit of that circle motion. It's like a hula hoop with the hip. And then you can go ahead and you can do the hula hoop motion backwards to reverse that. Okay? Do you want to show them seated?
Sometimes patients have a really hard time doing that initially, and they're doing it, but they don't think that they're actually actively using it, but they are. So I would put them seated, and I'd have them let their arm hang, and take this hand and just push it back and forth. So this is just dead weight, and then I'm here, and then I can push here. And if you're trying to limit the amount of movement that you get, because once you get to a certain point, muscles will kick in a little bit. That supraspinatus will actually engage, and most rotator cuffs are supraspinatus, and so you don't want those muscles to engage a whole lot. So, I mean, I can do circles here, okay? I can do them all in this area in a small controlled environment. So a lot of times initially, I would give them this, and then once they learned how to do them, how to relax that, I can move them up to there.
I will tell you this, to get people to do this, and they're like, oh, look at, I'm really doing it. They guard. If somebody's guarding, go ahead and lay down on your tummy. So it's kind of, that's when I take them to the method that Shannon's done, or sometimes I'll let them just hang that arm off the edge, and as part of my passive range of motion, I just do this, okay? And just bat it back and forth. It gets them used to the idea, okay? And I can go ahead and I can take it in and out, and you know what, I can do circles just like what Shannon was doing up there. They have got to get that arm moving. So whether they do it or you put them on the table to get them relaxed, doing this though, where they keep it locked up and they're thinking, gosh, these are tough, is not the idea of that. So somehow you got to get them moving in another way so that arms gets swinging.
So we didn't do shoulder extension or shoulder adduction or horizontal ab. Do you not do those?
I know. I usually don't. I don't do abduction. I do it with a horizontal adduction. So it's kind of like they can come out to neutral on there and then cross over. Extension I'll show you how to do because you're going to be in a sideline, and then we're also going to do scapular mobilization. Okay. What's that?
Drew gets booted for that. How about when you for that?
Okay, but I'm going to go ahead and I'm going to grab pillows back here. So those are your Codmans, and I'm going to let you guys try them here after